Hi, my name is Ethan Freed. I'm the Associate Chair for Education and the Residency Program Director for the Internal Medicine Residency Training Program at Lenox Hill Hospital in New York City. This is the second video in a series, and it's meant to point out the factors that contribute to our fabulous record in terms of quality, scholarship, and diversity and equity. We already pointed out in our previous video that Lenox Hill enjoys being ranked in the top 50 in the nation in many internal medicine specialties and other specialties and procedures, and that the quality of the environment in which you train has very definite, long-lasting effects on the quality of the medicine that you practice going into your career. Lenox Hill, as we said, is nationally ranked in 9 adult specialties, about 5 of them in internal medicine and the others in surgical specialties. We are regionally ranked as the number 4 best hospital in the New York City and the New York State region. And we also are ranked highly nationally in 2 other adult specialties where we're in the top 100, not the top 50. Lenox Hill is a 4-star hospital as rated by the Center for Medicare and Medicaid Services. This is the rating that patients use in order to choose which hospitals to go to, and we are a 4-star rated hospital. There are only a couple of 5-star rated hospitals in New York City, and they tend to be specialized hospitals. We are a 4-star generalized hospital. In addition, we have a very successful quality improvement and patient safety curriculum as part of our training program. This curriculum is available actually to all the training programs across Northwell, but it is definitely used. In fact, we're on our 4th year of running the quality improvement and patient safety curriculum for our own residents. A lot of the material comes out of this book. This is a textbook of patient safety. I have a chapter in this book, and the 2nd edition is just about to come out. Let's talk about scholarship. So if you go into PubMed and you look for the number of publications produced by our faculty, you will find 1,571 results over the last 5 years. So that's a little over 300 results every year from our faculty and from our trainees. Our residents fulfill their scholarly requirement by presenting at resident grand rounds. These are grand rounds level presentations by each and every PGY2 and PGY3. So over the course of the training program, for a categorical resident, you will build up a resume of topics that you have instructed your peers on. Now, the Resident Grand Rounds series has some rules. All of the presenters get a content mentor as well as a presentation mentor. And that's to make sure that for every 40 minutes of content, there are also 20 minutes of audience engagement exercises. Modern learners, such as yourself, really need audience engagement exercises in order to make the material really last in your minds. So we've organized our Resident Grand Round series around the principles of adult learning. Going back to our quality improvement course, the quality improvement course has allowed many of our residents to do a number of projects, quality improvement research projects, and many of these have gone on to be presented at regional and national meetings, including the CHEST meetings, the AGA meetings, the American Gastroenterology Society, the Society of General Internal Medicine, the American Heart Association, and the New York chapter of the American College of Physicians. And you can see year to year, more projects are being completed and more projects are being turned into scholarship, posters, abstracts, and full-length manuscripts. Now let's turn to justice, equity, diversity, and inclusion, or what we call JEDI. Northwell Health, our parent organization, enjoys Hall of Fame status after being chosen the #1 health system for diversity by Diversity, Inc. 4 years in a row. Our training program utilizes a holistic recruitment strategy where we screen out and block all references to gender, to self-identity, and anything else which might add intrinsic bias to the recruitment process. This ensures that we are able to recruit a diverse training program as well as a diverse faculty. We use behavioral interviewing as well as part of our holistic recruitment, as you will soon see. As we have mentioned before, Lenox Hill attracts patients from the Upper East Side, but also from all over New York, as well as the tri-state area. Lenox Hill is a magnet hospital for nurses, which means we attract the best nurses as well. And in terms of our patient population, we have a population which is incredibly diverse as well. Half of our patients are white, a quarter of our patients are African American, about a fifth of our patients are Latinx, and there are multi-ethnic patients as well. In addition to this diversity in terms of ethnicities and population, we have a diverse payer mix at Lenox Hill, with about a little more than half of our program on Medicare, about a fifth of our hospital on Medicaid, and about a quarter privately insured, as well as a certain proportion of uninsured patients. This diversity in terms of ethnicity and payer mix ensures that we see a diversity of pathology. We like to say, if it doesn't come to Lenox Hill, it doesn't exist. And we see those pathologies at virtually every stage of their development, with well-endowed patients who have lots of access to care, and we see them at the earliest stages of their illnesses, and then disenfranchised patients with no access or little access to care, whom we see at the later stages of their illness. Every pathology at every stage. Again, if it doesn't come to Lenox Hill, it doesn't exist. Our Justice, Equity, Diversion, and Inclusion program starts with the Hall of Fame status in Diversity, Inc. as the #1 best healthcare organization for diversity 4 years in a row. Our holistic recruitment strategy and our curriculum and cultural competency ensures that our training program and our residents have a patient mindset and are aware of and work with social determinants of health in order to achieve the best outcomes in care. Our relationship-centered communications curriculum is what helps our residents to identify with patients and to basically speak their language. First and second year residents in our program undergo a series of objective, structured clinical exercises to improve their communication skills. Stations include taking a culturally sensitive history, breaking bad news, expressing empathy, working in interdisciplinary teams, doing handoffs adequately from one team to another, teaching medical students, discussing goals of care with dying patients, giving discharge instructions to patients being discharged from the hospital in order to avoid readmissions, working with angry patients, and using motivational interviewing in order to get patients to give up bad habits. Social determinants of health and equity are included in every didactic presentation in our program. Our shelter medicine program is now in its 3rd or 4th year. This is a program where residents provide not only health literacy, but also primary care to a women's shelter on Park Avenue. It started out as an idea of just a few of our residents. Today, it is a well-funded program providing care to a large number of patients. And finally, our Physician Alcoholism and Other Addiction Training, or PAT, which includes the screening, brief intervention, and referral for treatment curriculum, or SBIRT, has been used in our program for many years. Our residents are even paired with AA, Alcoholics Anonymous patients as buddies in order to help understand patients with addiction. So please join us for our other videos that delve further into our curriculum. Thank you.